As a system built and refined in England, care for the elderly had major implications from the 12th to the 15th centuries, where 700 shelters were built. As one aged, the ability to care for self greatly diminished, spawning the need for assistance for activities of daily living. Thus, aging, medicinal care, and the need to carry on activities of daily living are all essential requirements of long-term care. An estimated 70% of people aged 65 or older will need some form of long-term care to help meet their medicinal and non-medicinal needs. The likelihood increases based on health status, disabilities, and if one is married, living with a partner, or single. The team players are patient, medical doctor, LVN, RN, CHHA, Certified Home Health Assistant, caregiver, and two types of pharmacists, a staff pharmacist and a consultant pharmacist.
I'm Amber Verdell. I'm a pharmacist and I'm board certified in pharmacotherapy and nutrition support. Long-term care includes patients who are admitted to nursing homes or long-term care facilities, as they're more commonly called. It can also include patients who live in assisted living facilities or skilled nursing facilities, depending on your definition.
There are two types of long-term care pharmacists. There's consultant pharmacists and staff pharmacists. Consultant pharmacists go to nursing homes or the site of long-term care and review patients' chart, look at the patient's medications, and optimize drug therapy based on drug interactions, duplications of therapy, or discontinuing certain medications that are excessive or not needed anymore.
So pharmacists are required to review the medical charts of patients in long-term care facilities. It's a federal requirement. So we have that going for us. They are not yet federally required to see patients or review patient charts if they're in assisted living or skilled nursing facilities. So the impact of the pharmacist is crucial because many of the medications that are administered to these patients, they come as a delivery once a month, and they're typically administered by either a nurse or a nursing assistant. So they don't get a daily review of their chart from pharmacists. So when the medication changes, the dispensing pharmacist may or may not know all of the conditions and whether the medication is appropriate, and that's where the consultant pharmacist comes in.
Staff pharmacists work at a central location where drug is dispensed from. They are the drug information specialists who provide information for providers and nurse. They are very similar to inpatient pharmacists. They verify drugs interactions, drug allergies, and they also prepare IVs.
What are the benefits of long-term care? As the need for care is on a patient-to-patient basis, this is a highly individualized field in which all who participate benefit. Patients who reside in nursing homes, skilled nursing facilities, retirement facilities, those who attend adult day cares, and those sent home with some form of continuing care from hospices to skilled nursing visits, all have been assessed for the level of need and those benefit. The benefits are patient-centered, aiming at keeping the aging population as autonomous as possible and as safe as possible. Vital sign monitoring, weekly daily communication with providers who are in direct care, and medication therapy management are all done by trained professionals, allowing the patient peace of mind.
Pharmacy has only existed for about 30 years, so it's one of the newest areas for pharmacists to work in, and they're predicting, again, with the aging population, that there's only going to be a higher need for patients, for pharmacists to take care of patients in long-term care facilities. I just did a web search, and there's 105 open jobs right now for pharmacists in long-term care in the Los Angeles area.